Surescripts was founded in part by pharmacies back in 2001, specifically to automate the prescribing process. Since then, we've done that. We do now about 5 million prescriptions a day electronically, and we've added a lot more, including electronic prescribing for controlled substance. We're really working with pharmacies to make the prescription that much more accurate and doing a lot to improve the friction that's in the prescribing process before the electronic prescription actually happens. Today, you can hardly open a newspaper or watch a news story without seeing something about the cost of healthcare and the cost of medications. And for the pharmacy, and specifically the pharmacist, this presents an incredible challenge. It's really the pharmacist who is there with the patient at that moment in time when the patient's experiencing a bill that they can't afford for a medication that they really need. And so it presents a lot of challenges for pharmacy today. Let me tell you a story, a personal story. I moved to Washington, D.C. from Boston about 2.5 years ago. And I went to the pharmacy to pick up a prescription that was a refill of a prescription I'd been taking for years. When I got to the pharmacy with a new physician, a new health plan, and a new pharmacy, which isn't a great combination, I tell you that, I was confronted with a really large bill. To make a long story short, it was 2.5 weeks of back and forth between me and the physician and the health plan and the pharmacy. 3 visits to the pharmacy before I finally got my medication at a reasonable cost. But it wasn't my medication. It was a therapeutic alternative on formulary with my health plan. That does not need to happen. The technology is there today. Surescripts is bringing the technology to physicians to be able to make a prescription that they know the patient can afford and conduct the authorization right there. And we're bringing that technology to pharmacists so that if the physician hasn't had it and the patient ends up at the pharmacy with a drug they can't afford or a drug that hasn't been authorized, the pharmacist can look right there online and see that information and or kick off the authorization right there in the pharmacy. In the pharmacy, the first thing that really Surescripts innovated with pharmacies and technology vendors across the country is the electronic prescription. And we're bringing the ability for a pharmacist to see the cost of a prescription out of pocket for a patient at that point in their benefit. And if the patient can't afford that medication, they can see, the pharmacist can see up to 5 therapeutic alternatives and their cost, so that the pharmacist can actually help the patient figure out what an alternative might be and send that back to the prescriber to give a suggestion for how they can change the prescription. We're also helping automate the authorization process in the pharmacy, which is a big deal, and taking friction out of the process. Ideally, when the pharmacist receives an electronic prescription, that's the end of the administrative work required to fill the prescription. There is no fax required back to the prescriber, no phone call to the health plan. The pharmacist simply fills the prescription and spends their time coaching the patient. And if something comes through without having an authorization completed or at an unaffordable cost for the patient, the pharmacist has the tools that he or she needs at their fingertips to electronically help the patient and help the prescriber even figure out that process right there. Surescripts is working across our entire network alliance to improve prescription accuracy. A few years ago, we actually convened over 100 different organizations, and we do that a couple times a year across all of the different aspects of healthcare, including pharmacy, to really address and discuss and workshop where in the prescribing process is the prescription going to fall victim to a potential inaccuracy. and how can we help as an industry change the accuracy of a prescription. At the same time, Surescripts was developing, and we did develop, an analytics program for our own transactions called Sentinel. So we analyze every transaction that comes through the network to assess accuracy, amongst other things. So in the since 2016, we've improved the accuracy of a prescription by 64%. Let me give you a few examples of what that means, because what really is prescribing accuracy? Well, for example, if a prescription hits a pharmacy without an authorization, for example, then the pharmacist has this fax process and all of that, which is time-consuming and leaves opportunity for problems. So just by using our exchange and that transaction, we've been able to improve the time to fill for those kinds of prescriptions. The other thing that's just amazing is we looked across the technology, across all the data, and found that the instructions that are given to a patient to take a prescription are actually subject to a lot of variation. We found that there are over 800 ways to say, take this tablet twice daily by mouth. 800 ways to say that. That's just a recipe for inaccuracy, and therefore really have worked across pharmacies and across our network alliance to try to figure out and try to really rein that in to make sure that those prescription instructions are correct. Those are just some of the ways that accuracy has been improved across the network.